Hi there, in this video we're going to be looking at baby choking. Now with a baby choking it's slightly different because they can't talk to us anyway. Now if you suspect a baby is choking, they're going to be very quiet. So I'll go up to the baby, I'll be able to tell they're choking because there'll be no noise coming out of them. They will also might start going blue depending on how long they've had the blockage there. With a baby I must always make sure I support the airway. Remember we said earlier in some videos that if that airway goes back like so, then it's going to be blocked. If the airway is forward like so, it's going to be blocked. So we must make sure the baby's airway remains neutral. Okay, so I'm going to support the airway. I'm going to lean the baby across my arm. You can do it across your lap if you wish to, making sure I keep this airway open. So I'm leaning the baby down. First thing I'm going to do, you can't ask a baby to cough. I can't ask them if they're choking because I'm not going to be able to respond. But I'm going to be able to do back slaps. So with the heel of my hand, I'm going to hit. I'm going to see if it's come out. Give it a chance to work. Hasn't worked. Hit again. Still hasn't worked. This is my third one. Still hasn't worked. 4. No. And 5. It's still not coming out. You will know when it's coming out because baby will start to cry. So I'm going to turn baby over now. And we're going to do what we call a chest thrust. So I'm going to aim this time in line with the nipples. Same place as I did a compression on earlier. But here, and I'm going to do a chest thrust, making sure I keep this airway open. So thrust, nothing come out yet. That's my second thrust, nothing out. Third thrust, no. Fourth, no. Fifth, and still nothing's come out. So if it still hasn't come out after I've done one cycle of up to 5 back slaps and up to 5 chest thrusts, I'm going to call 999 and I'm going to carry on with up to 5 back slaps, up to 5 chest thrusts. Now, of course, if the baby does stop breathing before I finish my one cycle, of course I'm going to call 999 and I'm going to begin CPR, starting off with my chest compressions. Now, as we mentioned earlier, if you've done a chest thrust to somebody, especially to a baby, make sure they go to hospital, make sure they go and get checked out, because it's not a normal thing to happen and they might need emergency medical treatment. In fact, they will need emergency medical treatment, so make sure they go to hospital. Now, if you've enjoyed this video, please hit subscribe. I'm here to give you lots of useful tips about first aid. I love teaching first aid. I've also produced lots of e-learning courses for you as adults, but also I've got lots of free children's first aid courses where I teach them important life-saving skills. And I'll leave a link in the description below for you so you have access to them.